in-service. I know you guys are OR. I want to keep this OR specific, and I'm going to tell you some of the things that I heard in the last in-service, and you can share with me some of the things that you're seeing. I just want to let you know, we welcome all your feedback. I want to hear good, bad, ugly, because this is how we learn and grow, and I am already going to be following up on a couple issues. Some of the things that they shared with me is in regards to battery life and transporting the bed. And also in regards to your monitor holder, they do come with straps, but apparently those straps are missing in action, but they're concerned about the grade of the monitor holder. And this is something I want to follow up on, because typically when you put, at least I know on our older models, when you put a monitor on here, it should stay put. Because I never had to use straps. You just plop them on there. But I get it how this would possibly be unsecured. So I'm going to be, just to let you guys know, I am going to be following up on that, and I will be getting back to Sharon and Joel. So just as a refresher, you have two cords over here. You have a gray cord and a white cord. And when I came in, they were both plugged in. Now for OR purposes, your gray cord is actually the cord that is powering the bed. That is bringing power to the bed and to the battery. This white cord, just so you guys know, is for your ancillary outlet that lives over here on the left side of the bed. And this would be something for the unit, like where they plug in sequentials for better line management. Just a heads up on that. Now you guys, this might sound redundant, but just FYI for you guys. So to use the IntelliDrive, first thing, of course, you want to do is unplug your bed. You unplug the bed, and now I want to put it in steer. That's going to be bringing the green pedal all the way down. Now, do you hear that noise? That is the motor engaging. Once you hear it stop, you have little platelets on the handles here, and you can literally just press. You shouldn't have to use your back. You can literally press to drive, back up. Very easy. Now, I'm going to go ahead and put it back. When you put the brake on, that's when you're going to hear the motor lift. Now, when you're butting the bed up against the bed, I can bring the green just to the middle portion here, and that's going to put the bed in neutral where you can move it side to side. We had a nurse ask me, because she had a bed that the battery was dead, she wasn't able to engage the IntelliDrive. What do you do? So this is the workaround, because I understand there's some challenges with you guys getting dead batteries. This is not ideal. What I would suggest to you is put the bed in neutral, and you can push like this. It's a heavy bed. I will tell you that, again, I'm going to work with our service manager and find out what it takes to get a full charge. I'm saying roughly about 2 to 4 hours. Typically, if you guys are getting a bed that's coming from the unit, that it has a charged battery, a battery life should last at least 4 hours. And that's with articulating. We're saying it should last longer if you're not sitting there articulating the bed. So if you're getting beds that have been plugged in, they should more than last battery-wise for your case, and you can get them to the unit. So I'm guessing you're getting fully dead batteries, is my guess. Again, that is a workaround. It is not ideal, and I would not have one person just pushing. If you possibly can, grab somebody, because this is a heavy bed. One thing that you can do when you have, just a little FYI, just so you know, if you have a patient that's full-figured, I know that you have roller boards and things, hover mats to help you. This is something that you can do once you have the bed butted up if you want to. Just an option. You can max inflate here on the side. When the bed is plugged in, you press this little button here. That turns green. That's going to max inflate the mattress. So if you're using a roller board, It's gonna help you pinch underneath. So just an option for you. Again, the only thing that does not work when the bed is unplugged is the mattress because it's an air system. So if you wanted to utilize this, after you get it butted up against your OR table, you would need to plug it in because this invokes the air system. Does that make sense to everyone? Okay, perfect. You don't have to worry about turning it off. It'll turn off in 30 minutes or when you unplug it.
Would it stay on if it's unplugged?
I'm sorry?
Would it stay on if it's unplugged?
Yeah. Basic buttonology, again, on the just so you know, CPR, you guys probably already know this. If you're in transport and you ever had a patient that you had to start a code on, the CPR button, you guys all know where it lives, just FYI, that when your bed is unplugged, mattress does not max inflate. You can use this is a backboard, certainly not ideal, but can be used because it's pretty thick. One thing I have seen folks do, but you can slip it under here, underneath the cassette drape to kind of give some cushioning. Bed would have to be plugged in for that max inflate to turn on. Battery backup, you can still shorten and lengthen the bed. You can do all the articulations. Only thing that doesn't work on battery backup is mattress. So if you need to raise the bed, raise the head of the bed, you can do that all on battery backup. Does that make sense to everyone? Any questions? What are some of the concerns that you have if I've missed anything? Is it mainly the battery and the monitor holder? Okay.
Can you just briefly go over all the different functions?
Sure. This right here, of course, your bed high-low. This is articulating your head, either low, excuse me, raising or lowering. Same thing with your feet. This right here is your max inflate. I just turned it off. This right here is chair egress. So when a patient is on the unit and they're getting ready to mobilize, the nurse can hit this. What that does, it max inflates the bum area, so it makes it easier for the patient to egress from the bed when they're in the sitting position there.
How's that different from the regular inflation? Just this inflation versus that?
Well, this is max inflate, just as the whole bed. This is just focused
Just
on
one
just
section.
their bottom. Over here, you have a one-touch boost. So this would probably be pertinent for OR if you got the patient too far down. It max inflates the mattress and puts it in trend. So you can pull your patient up. You have a reverse trend. A trend. This button here, it completely flattens your bed. So it completely gets your bed flat. This right here is your full chair. This particular bed can also do what they call a chair egress, where people can they take off the footboard and they can egress from the bottom. This part of the mattress all deflates. This is where you can shorten your bed, where you have the arrow going in. And this is where you can lengthen. Typically, if you guys are transporting, you're probably more concerned about shortening. This is where you can lower the knees, lower the feet. And this is where you can raise. Again, high-low. If you look down here, I don't know if you guys ever use this. If you hit your foot against that button, there we go. Once you hear that beep, now I can articulate hands free up and down. Make sense? Okay. Any concerns or questions that I missed?
What about this panel?
This is your touch screen. Do you guys use this?
No.
Okay, I'll just go over it, just good to know. So FYI, if you remember nothing today, see this question mark down here? I can hit that, and it's like a built-in user manual. And it'll literally, like for example, let's say you wanted to know how to zero the bed, or how to do CPR, or where the CPR was. It literally shows you where it's at. I can go back and say, okay, where are my patient restraints at? Let's say you're gonna put restraints on people. It will show you where they're at. So if you remember nothing, remember this question mark here. It's like a built-in user manual. I can hit the home screen. You notice over here at your sides you have this little bell. That would be for the unit's bed exit, bed alarm. This little scale here is when you're zeroing the bed or you're weighing the patient. This right here, I call him my flat man. Same thing as this. Brings your bed back into the flat position. This is your settings. And this is just reminders. So unit nurses can actually, if they're using P&V, the percussion and vibration, or they're doing the rotation therapy, they can even set reminders for themselves that the bed will beep when they need to turn their patient. This is just giving you a little status on the bed on what it's going on here. It tells you that the bed alarms are not on, that the head of the bed is zeroed. This is telling you that the bed is completely flat here. So if you had max inflate turned on, it would be like a bright colored green. Any questions, guys? One thing when you're transporting, ideally, when you're bringing the patient over, this is your hip alignment here. The reason we have this on here, because when the bed is articulated up, this is at the pivot point of the hips to decrease migration down.
What's the difference in inflation between the maximum and just regular inflation?
And normal?
Yeah.
Okay, so this is considered a therapy surface. So it is, you guys ever been on a sleep number? Where it has that pressure redistribution, it makes sure that it's moving with you. So when you have it on max inflate, it no longer has pressure redistribution. The mattress is hard. And that's done usually for like moving a patient like from bed to gurney or gurney to bed, just to make it easier for you. Or if let's say you're pulling a patient up, it's just to help move the patient. It's certainly not something that we want the patient living under. That's why we put an automatic turn off of 30 minutes, because then you want the patient to go back on that therapy surface.
And the CPR mode is the same, that's the same thing as max inflation.
I'm sorry?
CPR mode is the same as max inflation.
CPR mode? No. When you hit, what CPR mode? Let's say you had the bed, I'll show you right here. Let's say you had the head of the bed up. Let's say you were transporting your patient like this, and you were going into a code. That's when you hit this. CPR mode flattens the bed. When the bed is plugged in, it max inflates the mattress. So, right. When the bed is plugged in, it max inflates. So that's what CPR mode does.
Okay, and how much power is the battery? That's the battery?
This is the battery. On a fully charged battery, this should give you 4 hours of power on a fully charged.
And how much do you have left when there's just 1 or 2? 3.
Can you unplug that gray cord for me? Okay. This is telling me that it's fully charged.
So if it's just 2 hours, this would just be 1 bar?
Right.
So now is it fully charged? Because it's off right now.
No, this is fully charged because when you had it plugged in, it was completely
So you
broke.
have to plug in to find out the battery power.
Right.
Okay.
So the chargers on this one with the no strapping, so when you reflex the knee indication, that's when it really
Right.
gets tilted.
These came with straps. Certainly not
Yeah.
ideal, but that's something like I said, that I was going to be following up with. One thing is, on our older models, you didn't have to necessarily, because there was a little ledge back here, but I'm gonna find out if there's, what we can do and what the workaround is. Because this is certainly different.
Yeah.
I get it, I loved these, but I get what you guys are saying, but they did come with straps, but that's not always ideal.
Well, all they do is tape it on there.
Yeah.
Or we don't
So,
use it, we'll just put the.
put
Yeah, or
it
they
on
can
the
put it on
bed.
there,
And
yeah.
it's meant for you guys to use,
I
but
know.
But, yeah.
let's see what, I'm gonna be working with the service manager, and, actually, I'm gonna be reaching out to our design team, because
Mm,
I wouldn't use this.
Yeah.
I should, I don't
I know,
think I
I'll take that off the
Thank
list.
you.